At this time, all participants are in a listen-only mode. After the speaker's presentation, there will be a question and answer session. And to ask a question during the session, you will need to press star one on your telephone. And please be advised that today's conference is being recorded. And if you require any further assistance, you may press star zero. I would now like to hand the conference over to your speaker today, Mr. Mike Schomer.
Well, thank you for joining us for the COVID-19 media briefing for May 14th. We'll start today with opening comments from Health Commissioner Jan Malcolm, Infectious Disease Director Chris Erzman, and COVID-19 Vaccine Equity Director Dr. Nathan Chomolo. We also have a couple of guests with us today, Lucas Ness, CEO of Minnesota Council of Health Plans, and Steve Gottwald, Executive Director of Minnesota Association of County Health Plans. After those opening comments, we'll take questions from reporters. With that, we'll now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. It's good to be with you today. We reported 1,306 more positive COVID-19 cases today, bringing us to a new total of 592,750 cases since the start of this pandemic. Some days less and some days more. We're still running over 1,000 cases on most days. We also, unfortunately, had 9 more COVID-19 deaths reported to the health department, for a total of 7,283 deaths since the start of the pandemic. We've lost an additional 250 Minnesotans just in the last month and 70 in the last week, just further indicating that this is still obviously taking a big toll on our community. There are 464 people currently in Minnesota hospitals being treated for COVID-19. 123 of them are in intensive care. Our steady but quite gradual reduction in these rates has continued for several weeks now, but do still indicate that we have still a lot of virus circulating in our communities. On the good news front, more than 4,750,000 total vaccine doses have been administered to almost 2,700,000 Minnesotans at the last report, as shown on our dashboard. This, as you know, is both first and second doses. Our most recent 7-day rolling average for all doses is about 36,000 per day. About 10,000 of those are first doses on that same 7-day rolling average basis. We're now at about 61%, just a little more than 61% of those over 16 with at least one dose, and over 88% of those over 65. As you know, effective today, Governor Walz has rescinded the masking mandate in order to conform with CDC's new recommendation that if you've been fully vaccinated, you no longer need to wear a mask in most settings. This is a sign of the progress that has been made in vaccinating Americans and Minnesotans, and really especially a strong endorsement in the effectiveness of the vaccines. Millions of Minnesotans are fully vaccinated right now, including a significant proportion of those who are at most risk of serious illness. Reminding everybody that fully vaccinated means a full 2 weeks after completion of the vaccine series. So that's 2 weeks after 2 doses of Pfizer and Moderna, and 2 weeks after the single dose of Johnson & Johnson. As I said yesterday afternoon with the governor at the press conference announcing the ending of the mask mandate, this is a sign of the progress we've made, while also still recognizing the need for caution, given that more Minnesotans are not yet fully vaccinated, including all Minnesotans under the age of 12. It's important to remember that CDC's guidance still says that if you have not yet been fully vaccinated, you should still wear a mask and practice all the other proven protection measures like social distancing. And our guidance at MDH will continue to mirror that of CDC, strongly encouraging mask wearing and practicing of other proven protection measures for those who are not vaccinated. Masks work, and if you haven't been fully vaccinated, they help to protect you and those around you. Vaccines, though, work even better. Millions of doses have been administered around the United States, and the results prove that the best way to prevent serious illness and slow the spread of the virus is to get vaccinated and to encourage your family and friends to get vaccinated as well. So I hope Minnesotans who haven't been fully vaccinated yet will talk to folks that they trust, your doctor, your pharmacist, community leaders, family and friends, about any questions you have about the value of vaccines. We want you to get reliable, accurate information to make good decisions for yourself in light of your own personal situation and risk factors. And it's really easy, increasingly easy, to find the vaccine near you. There are several sites, as you know, mn.gov/vaccine or vaccines.gov, find an appointment near you. And also just a reminder that you can now directly schedule an appointment at one of the state sites on the Vaccine Connector. And with that, I will turn it over to Chris Ersman.
Thank you, Commissioner. Yesterday's announcement from CDC was a significant development that was news to all of us, just as it was to all of you. We know everyone has their own level of risk tolerance, and we know there will be a lot of questions people will have about various situations and contexts. We are working hard to adapt our web content and guidance documents and should have updated information in the coming days. And I'll just note that when in doubt, wearing a mask is always a good idea. Some people will be thrilled to no longer have to wear masks in many settings, while others will still want the assurance and protection given that there is still so much virus circulating. And both of these reactions are normal and understandable. This announcement underscores a few key points. First, it's important that eligible Minnesotans 12 and older who have not yet been vaccinated get vaccinated. As the commissioner said, it's never been easier to get the vaccine, and there are many options available to do this, many different settings, many different providers, and many locations. Second, until you are fully vaccinated, which is 2 weeks after a second dose of Pfizer or Moderna, or 2 weeks after the single dose of Johnson & Johnson, it's important to use the other protective measures that have been shown to work, and that is masking, social distancing, hand washing, and staying home when sick. Third, it's important to remember that there will still be communities, businesses, and settings that require masks. Among other settings such as healthcare, this includes public transportation like buses, trains, airplanes, and transportation hubs like stations and airports. It's really important that these requirements are respected and followed. I want to particularly emphasize the healthcare settings here. Hospitals and health systems care for some of our state's most critically ill patients, some who are at high risk for COVID complications and death. Wearing a mask, regardless of your vaccination status when you enter a healthcare setting, helps protect these vulnerable populations. Fourth, if you have a weakened immune system, we recommend you consult with your healthcare provider on whether you should continue to mask and social distance, even if you're vaccinated. The virus is still out there in our community, as you see from our daily numbers. It's still very much a threat to those who are not vaccinated. And as a reminder, we still have many Minnesotans who are not vaccinated because they are not eligible for vaccine, and that includes all children under 12. Regardless of how anyone may personally feel about the risks, we owe it to all those Minnesota children under 12 and others who have not yet had the chance to be vaccinated to do the right things to prevent COVID transmission. And the best tool we have for that is getting vaccinated, not just for your own good, but for that of your family, your friends, and your community. As others have said, the government requirement may be going away, but the public health recommendations remain in place, and there's still a need for individual responsibility. According to CDC, anyone who is not fully vaccinated should continue to wear face coverings indoors and outdoors in crowds, large venues, and certain other settings, and practice social distancing. So many Minnesotans have worked so hard and done the right things for themselves and their neighbors, and we ask that you continue to do so even as we transition into this new phase. And with that, I'll turn it over to Dr. Chimillo.
Thank you, Director Erzman. I want to start today with some clarifications on what our vaccine equity metric is capturing. The Social Vulnerability Index, or SVI, is a marker of structural inequity. It identifies areas where communities are at a disadvantage due to historical and persistent underinvestment. SVI zip code quartiles are therefore grouped to create an understanding of areas based on their degree of disadvantage. For example, quartile 1 or Q1 SVI zip codes equal high disadvantage. Because of structural racism and inequity, we know that Black, Indigenous, Hispanic, Latinx, and Asian Pacific Islander communities, as well as people experiencing poverty, are more likely to live in Q1 or high SVI zip codes. Prioritizing our COVID-19 resources, including vaccines, towards these areas is therefore one way we address structural inequity head-on. Using our SVI equity metric, we will provide an update on the COVID-19 burden and our vaccination efforts going forward on a regular basis. Over the last week, cases, hospitalizations, and deaths remain overrepresented in Minnesotans who live in zip codes classified as Q1 or high SVI zip codes. Though residents of high SVI zip codes make up 29% of Minnesota's population, they make up 32% of cases, 39% of hospitalizations, and 38% of deaths due to COVID-19 as of this week. Current vaccine coverage is lowest among Minnesotans living in high SVI zip codes. Statewide vaccine coverage is at 61% by first dose, while 57% of Minnesotans living in high SVI zip codes have had their first dose, compared to 65.7% of Minnesotans living in low SVI zip codes. However, since our equity allocation goal, we have seen a decrease in the gap of first dose coverage between Minnesotans living in high SVI zip codes and those living in low SVI zip codes. A look at our state's progress using the SVI equity metrics is now available on our public dashboard. As Minnesota begins to offer COVID-19 vaccination to children ages 12 and up, there are several steps pediatric providers can take to help mitigate the gaps we have seen in access to and uptake of the COVID-19 immunization among adults, as well as help ensure we prioritize those children and families from areas hit hardest by the COVID-19 pandemic. Similar to the overall population, the impact of COVID-19 has been greatest among children who live in high SVI zip codes, and in fact, the impact has been even more disproportionate. Children under the age of 17 who live in high SVI zip codes in Minnesota have experienced 45% of all COVID-19 hospitalizations to date. Given what we know about the disparate impact COVID-19 has had on communities in Minnesota, the structural and societal barriers many children and families face in accessing even routine care, and the disparities we have already seen in COVID-19 vaccine rates for adults, it is critical that pediatric providers take steps to not only mitigate further inequities in access, but continue to build a more just and community-driven approach to health in response to the COVID-19 pandemic. MDH will be publishing COVID-19 vaccine equity guidance for pediatric providers, including suggested steps to increase equitable access to pediatric COVID-19 vaccination, like decreasing barriers for families seeking vaccine appointments, preparing to address COVID-19 vaccine deliberation and hesitation, and focusing outreach on children and families who live in high SVI areas or from communities that have already experienced a high burden of COVID-19. As we move into this next phase of vaccination, equity-focused outreach is an important tool we have to continue our goal of immunizing for impact. I'm therefore very pleased to announce today that the Minnesota Department of Health and Minnesota Department of Human Services are partnering with Minnesota Health Plans to improve COVID-19 vaccine equity and access. Starting next week, the organizations will work together to identify Minnesotans who have been most impacted by COVID-19 and continue to face barriers to getting vaccinated to connect them with vaccination opportunities. The partnership program will work to reach Minnesotans enrolled in Minnesota healthcare programs, such as Medical Assistance or MA, Minnesota's version of Medicaid, and Minnesota Care, who live in high SVI zip codes and have not yet been vaccinated for COVID-19. The health plans will work with the state to contact members and provide information on vaccination, assist with scheduling appointments, and help plan for their vaccination, including arranging transportation or other services if needed. Participating health plans starting this work next week include Blue Cross and Blue Shield of Minnesota, Health Partners, Hennepin Health, Itasca Medical Care, Medica, Preferred One, Prime West Health, South Country Health Alliance, and UCare. Blue Cross and Blue Shield of Minnesota recently conducted a 2-week pilot of this program using text message outreach that contributed to a dramatic increase in walk-in appointments at our state sites within a week following the text campaign. Given the structural and societal barriers Minnesota healthcare program enrollees faced in accessing care even before the pandemic, this partnership is a recognition that we need to continue to go the extra mile and rebuild trust with communities we serve and help mitigate further inequities in access. We are pleased to have Steve Gottwalt, Executive Director of the Minnesota Association of County Health Plans, and Lucas Neese, President and CEO of the Minnesota Council of Health Plans, join us on the call today to help any questions about this exciting new partnership. And with that, I'll turn it back over to you, Mike.
Thank you, Dr. Tremolo. Operator, we're ready to take questions.
As a reminder, to ask a question, you will need to press star 1 on your telephone. And to withdraw your question, you may press the pound key. First question comes from the line of Peter Cox of Minnesota Public Radio. Peter, your line is now open.
Thank you. I'm wondering, I guess, your thoughts on different cities and counties kind of having their own mask mandates across the state, and if you're encouraging any cities or counties that have maybe a higher positivity rate to put in a mask mandate right now.
Peter, this is Commissioner Malcolm. I think it's been a really core public health principle for a long time that we always support the right of local jurisdictions to set public health protection standards that are higher than a state minimum. So we certainly respect the decisions being made by local jurisdictions to perhaps keep their mask mandates. And it actually is part of the CDC guidance and likely will be part of ours that we do encourage local jurisdictions to consider the rate of case growth, test positivity, and some of those other critical public health risk measures as they are looking to make those local decisions. We are not specifically urging anybody in specific to do that, but just making sure that they have good data to consider those issues.
Following up, I'm just wondering how much of a concern you have that people who were hesitant already will see this dropping of the mask mandate as kind of them being more likely to skip it now.
And I think that's something we certainly will watch for. I think, as we talked about yesterday in the press conference, there's some concern that every time the rules, so to speak, are relaxed, people might draw from that the inaccurate conclusion that everything's just fine now and that the pandemic is over. And that's why we'll keep reinforcing the fact that there still are a lot of people at risk. There's a lot of virus out there. We still are in a race against time, against the variants, and we'll do everything we can to encourage people to not only get vaccinated, but to prioritize it and to do it sooner rather than later. We need to keep making progress on vaccination in order to mitigate the effects of any of these variants of the virus, and to help prevent a future resurgence of the virus. So we're definitely going to continue to try to increasingly tailor those messages to folks, just given kind of what their particular questions or issues are with respect to vaccination. But we'll certainly closely be watching to see. And I think it'll be hard, frankly, to tease out exactly, what's driving what as we see these vaccination numbers slowing down around the country. But as we've said so many times, we think that the responsibility is on us to make the vaccines more and more accessible and to give people the information they need to make a well-informed decision.
Thank you.
question comes from the line of Glenn Hallett of Star Tribune. Glenn, your line is now open.
Thank you. MDH has always acknowledged that whenever there's a turn back of the dial, that there's likely to be more cases. And I just wanted to get your thoughts on what this could do to increase transmission, especially because some people who are unvaccinated may feel free not to wear masks, and that will make them vulnerable to coming down with COVID.
Well, this is Commissioner Malcolm again, and I'd certainly invite Chris or Dr. Chomolo to comment on this as well. I think that's quite accurate, Glenn, that we just know that anytime there is more interaction, when there is this level of virus circulating, there will be more cases. And I don't think there's much dispute about that. I think that's mitigated to some degree by the fact that more activity is happening outside in the precious Minnesota spring and summer, and the fact that vaccination rates do continue to march steadily upward, not as quickly as we would like, but still making forward progress every day. So we're hopeful that those favorable trends are more powerful than the added risk that we know just exists when more interaction happens. But Chris, Dr. Chomolo, anything you'd add?
Well, thank you, Commissioner. Yeah, I would just remind folks that as I mentioned, the official requirement for masking, is being rescinded, but that doesn't mean that the public health recommendation that those individuals who are unvaccinated mask went away. We still recommend that. And so, we're hoping that individuals will keep that in mind. I mean, we've seen the positive impact of vaccination over the last few months and how it's allowed us to, avoid some large peaks in case numbers. But you're right, if people perhaps take the wrong attitude about this to say it's over and everything is fine, we could see spikes in cases. And so it will be important that we continue to make those messages clear, and that we appreciate the media also helping us to achieve that as well, that we're in a new phase, but that doesn't mean that risk has gone away. And so people need to continue to make choices to protect themselves.
And I think that I'll add that highlights just the role of our local jurisdictions in kind of determining what their communities, current risks are, weighing the vaccination rates of members within their community, and making sure that it makes sense for them to have a mask mandate or not, in addition to other public health markers. And so I think for each community, the risk is going to be different.
And you touched on this yesterday in the press conference, but I'll ask it again, because some governors have decided to not do away with the mandate altogether, but essentially echo what the CDC said. If you're vaccinated, you don't have to wear a mask, but if you're unvaccinated, you have to. Why did Minnesota not go that route, given that all of the measures right now are in the cautionary level of case growth and those things?
Commissioner Malcolm again. We certainly did discuss that, and I think it really comes down to just a matter of how do you operationalize, and what are the practical effects of such a sort of a bifurcated mandate, if you will, trying to figure out to whom it applies and to whom it doesn't, and how you police that. Certainly, we've heard from a lot of our local public health colleagues that they would find such a mandate impossible to enforce. So it was really, I think a pragmatic decision just based on the difficulty in enforcing, a partial mandate, if you will. We're certainly interested in seeing what the experience of other states are, but in talking to our colleagues around the country, I think even those who really would like to keep such a kind of a bifurcated strategy, the how to operationalize that is a real conundrum.
Thank you.
Next question comes from the line of Jennifer Merrily of WCCO TV.
Thank you for taking my question. This is for, I guess, Commissioner Malcolm and Dr. Chomolo. Commissioner Malcolm, it seemed yesterday there was some hesitancy, and you even said that, you have mixed feelings about raising the mask mandate. And there have been, not only 61% of Minnesotans that have been vaccinated that are eligible, but the equity piece, where we see our numbers very low with, in certain demographics. And I'm just curious, what will this partnership help? What can be done? Are there still concerns, surrounding that piece of it as we lift this mandate? Sorry, I know there was like 3 questions in there.
Well, I'll start and then turn it to Dr. Chomolo and our guests if they would like to make a comment. I think my expressed kind of mixed feelings yesterday was precisely because, we know there are still a lot of vulnerable folks, particularly among those who've been the hardest hit already by the virus, both from a health perspective and in other ways as well, economically and otherwise. So we are, it is critical that we maintain and keep on our commitment to keep working on this equity piece. That even after we hit the 70% goal or the goal after that, we have to keep going, particularly on this equity piece. Dr. Chomolo, would you like to start, and then we'll welcome our guests to chime in if they'd like.
Yeah, absolutely, and thanks for the question, Jennifer. So yeah, that remains a concern of mine, because we know that, as we talked about a little earlier, not every community has had both the access to and is taking the vaccine up at the same rates, and so having this other public health measure no longer mandated does present different levels of risk to different communities. And so, specifically, when we look at data from national surveys, it's not only access to the vaccine itself, but it's actually access to reliable information that we see is just different in different communities, with African American, Hispanic, and some Asian communities having less access to the same type of information to make decisions for themselves and their communities and their health. And so, the piece of this partnership, a couple pieces of this partnership that I think will be particularly helpful. One is it's targeted, and so it's starting with Minnesotans we know that have already faced an increased burden by looking at their SDI zip code and their enrollment with our Minnesota healthcare programs. And then it also we're providing our partners with information to kind of help address some of the questions that may come up about the vaccines, their safety, their efficacy, different questions that have come up with different populations, so that they can help their members, our neighbors, navigate that decision for themselves. And then it's helping try to break down some of those barriers, looking at things like transportation, if interpreter services are needed, knowing where near them they can have access to a vaccine. And so I think that the partnership will help. But certainly that's why, in the meantime, certain cities and counties and other jurisdictions that are looking at their data and seeing that there's these gaps may decide to continue the mask mandate, and that's something we certainly encourage.
Thank you. And just as a follow-up, is there anything else to do beyond this partnership to address this? Because when I'm looking at the data and just seeing, less than 50% of most Minnesotans, of most demographics, are vaccinated. It's, when you are able to see that on the website and break that down, you see it's a striking difference. And in Minneapolis, the numbers of 71% of whites living in Minneapolis have received one dose, while 35% for Hispanic and 28% of Black or African Americans.
Well, thanks, Jennifer. And that's why we think it's so very important to be, publicizing data like this to point out where the issues are, to hold ourselves and all of our partners accountable for working to close these gaps. Dr. Chomolo, maybe you just want to remind a bit about the range of strategies in addition to this health plan partnership that we're working on.
Yeah, certainly. And this partnership is one of many strategies. It's what we'd consider, a more time intensive. It's basically cold canvassing and, getting out the vaccine, as Lieutenant Governor Flanagan has coined in previous appearances. And so really, it's really time intensive. So its ability to do the job all by itself is minimal. It's going to need many other strategies, and we're approaching that by hosting more and more community-based pop-up events so that folks can find vaccine in places that they're already going, whether it's food distribution or faith-based centers, community centers, or schools. We're doing our mobile vax units are going up to 4 buses this week, and we'll be up to 6 buses next week around the metro area, around the state, bringing vaccines directly to folks that way. We're launching an individualized outreach program to really help get folks, again, information about the vaccine, as well as helping schedule. And so there's a number of ways that we're using this data with our equity metric to really target, and sometimes down to the very census tract level where we're seeing gaps in immunization take up, to really try to figure out how we can find the best messengers to answer questions, and then find best ways to get vaccine opportunities to our neighbors.
Thank you. And I guess one just last follow-up is, what is the message to these folks that some I'm seeing saying, I'm still concerned about my community because not enough of us are vaccinated? What is your message to them?
Well, I think we all share the responsibility of knowing and acting on the fact that the virus is still out there, that we still have a responsibility to each other to be working to do everything we can to further depress the cases, continue the momentum that we're on now, but accelerate it, and continue to learn about and prioritize getting a vaccine as soon as you can. Intending to do it sometime is certainly great, but again, I think the more people we can get vaccinated, the sooner, the better off we'll be in terms of further depressing these case counts and preventing a future resurgence.
Thank you.
Commissioner Malcolm, if I might, this is Steve Gottwald with the Minnesota Association of County Health Plans. I just want to say that we really appreciate this partnership between the health plans and the Departments of Health and Human Services, because we're doing this in a data-driven manner. We're taking in data both from the state level and from the health plan levels, and we're using that, putting our heads together about best practices for getting to the communities that have not been reached so far. So this is a very important time for us to be driving this deeper and getting more people vaccinated. And putting our heads together has been great. We've been working on this for a couple of weeks. It's exciting to announce this, and we're just very happy to be part of this effort to really get to people who haven't had the opportunity to get vaccinated yet.
Next question comes from the line of Jennifer Hoff of Care 11.
Hi, thank you for taking my call. I know Chris had sort of touched on this about when in doubt, wearing a mask is always a good idea, but I was wondering, because we're getting a lot of viewer questions still from parents in particular who would really like some maybe more detailed guidance on what am I supposed to do if I'm a vaccinated adult and I have a child who just, for whatever reason, whether it's age or disability or other vulnerabilities, that can't get vaccinated yet. What sort of guidance would you say to them today?
Chris, would you take that one?
Sure. And Jennifer, could I just clarify? So the parent is thinking about their personal risk to their child, or just thinking about their child being sort of out and about in the world and unable to be masked?
I think more out and about is where folks' questions are coming from. I think Jan touched on the personal risk a little bit yesterday, but if folks were worried about, finally going to the grocery store or taking a trip or something along those lines, and they were concerned about their child who can't get vaccinated.
Right. So, that's actually a good point, and that's why we wanted people to be aware of the fact that, for children less than 12, regardless of health status, they are not eligible to be vaccinated at this point. So they remain, vulnerable to COVID in the absence of a vaccine. And that's why it's so important, that we think about not just, there's not a legal requirement for masking, but I'm doing this because of the impact it can have on others. When we started out with the mask discussions, we talked about how my mask protects you and your mask protects me. And so I think that's an important thing to think about. And I think for the public to recognize that it's just fine to keep wearing masks. That doesn't, this change in the executive order doesn't mean that you can't wear a mask. It's just taking away that requirement that existed before. So I think for parents, I recognize that it's stressful, and colleagues at the department who have children who are, under 12 have expressed their concern as well that, man, we were feeling good about things, and now, do we really want to take our kids out and about, those types of things. So I think that's just a message to all of us in the community that we want to make sure that we're taking the mitigation steps that are necessary to protect the people around us. And so that means if you're not vaccinated, wearing a mask. And even if you are vaccinated, if you wear a mask, that's not the wrong thing. And like I said, when in doubt, wearing a mask is just fine. So we want to make sure that all members of our community can feel comfortable. And sometimes wearing a mask helps to achieve that.
A quick follow-up then, and I know it's hard to look in the future, but we had someone else ask, would there ever be a specific threshold then in place that might happen to know when we may be asked to have a statewide mask mandate again?
I'll let the commissioner answer that one, but I do have a comment about vaccination, though, Commissioner.
Go ahead and start, Chris, and I'll chime in.
Okay, well, I was just going to say that our goal, as the commissioner said, to keep encouraging moving that vaccination, the proportion of our population that's fully vaccinated, to keep moving that up. The point of that is so that we don't have to reconsider those types of things like going backwards with mandates. But I'll defer to the commissioner because certainly those decisions are not mine.
I think we've learned a great deal this last year, and a lot of it's been very painful learning. And we've learned about the importance of paying attention to some of these risk measures. We've also learned about the incredible protective value of the vaccines. As the governor said, it's really clear that the fact that we did a good job as a state getting a lot of people, particularly high-risk people, vaccinated quickly early on, clearly helped to blunt what could have been a worse wave, this early spring than we saw late last fall. But it didn't happen because of the impact of vaccines. So that certainly will remain our goal, to not have to go back into these kind of more blunt instrument measures of society-wide mitigations. But we will continue to be prepared, to deploy the lessons that we've learned. Should there be, further resurgences in the future, and what's happening around the world still is something that we all should be aware of. And I think getting the world better protected is going to be important to our future ability to avoid having to go, kind of back into some of those more sweeping measures.
Thank you.
Next question comes from the line of Jeremy Olson of the Star Tribune.
Hi, if I look back a few months, we were talking a lot about how mask wearing alone wasn't enough, and then social distancing alone wasn't enough, that it was the combination together that was effective. But along the way, we've really kind of separated out those policies. Yesterday, it looks like we knocked out the mask mandate, but it appears we still have some social distancing and capacity restrictions in place, unless I'm mistaken, through May 28th. I mean, is it odd that we've kind of separated those? And is there any point left to the kind of capacity caps and things that are still in existence?
It's a interesting point, Jeremy. You're right. We do think that those various mitigations were helpful, layers on top of each other and just reinforced each other. The reason for keeping the other mitigation measures in place until May 28th is that that's a reasonable, kind of glide path for, and I think the governor spoke to this, or Commissioner Grove did a little bit yesterday. There's some work to be done in the settings, the workplaces, the public establishments that have set up different workflows and different physical barriers and so forth, that takes some time to plan for, taking that down or replacing it or figuring out what kind of mitigations various enterprises might wish to keep. So having kind of this process in place and folks working toward that date just seemed to make a lot of sense to us to continue.
Commissioner, can I just add that the ultimate mitigation measure is vaccination, and that's something that is layered on all of this, and that the fact that we have 61% of our population with a first dose, that is a really strong mitigation measure that layers on, in addition to the masking, social distancing, all those other mitigation measures. And like I said, that is the ultimate mitigation.
One other question, we kind of came late to the idea of using apps that kind of were able to identify exposures anonymously, even though those had existed for a while. There was some reticence and concerns about the privacy. I wonder the same about this issue of a passport. Was there, we kind of passed on it really quickly. Of course, you didn't have a lot of time to consider it, but would it have been unworkable with all the mobile phone technology and other things, to have some kind of passport or requirement in place that would have, allowed you to create a bifurcated system for the vaccinated and the unvaccinated?
Well, I think it's a great question. It's one of those things that I think is would benefit from further policy discussion at the federal level as well. That what is the appropriate balance between tools that could allow you to continue to be more targeted in your responses, balancing that with concerns not about privacy and other implications of creating requirements of that nature. I think the president and many governors have sort of expressed some intention not to go in that direction. I think it possibly is a conversation that should continue in policy circles. Taking the time to, as you said, Jeremy, kind of more fully discuss the pros and the cons and whether there's a way to balance those issues. But at the present time, I think the policy direction federally as well as at the state level has been not to use that as a government tool, at least, which is a different thing from saying what individual businesses, for instance, should be able to do if they want to.
I'm sorry, I meant to squeeze this in, but the governor had kind of nodded toward the idea of free fishing licenses for people who got vaccinated. I just wondered what you thought, separate from this, about incentives or other kinds of incentives. Now that we took away the vaccination sort of as one incentive, what do you think about some of these other incentives other states are doing? And would you want to see them in Minnesota?
Well, we are exploring that and working with some of our great companies in Minnesota that are interested possibly in supporting that sort of an effort. we're intrigued by what other states are doing. It's still pretty new. Most of those programs are just rolling out now, so there's not a lot of data yet on how much difference it makes. But I think we're very much in the mode of looking for all kinds of creative ways of encouraging that demand. And again, from the standpoint of kind of keeping up a sense of that the timeline does matter. That the faster we can get to a higher level of protection, the better. So we'll continue to explore that. I think you can. I don't have anything specific to announce today, but it's something we very much are interested in, and talking to other states about what they've done and how they've done it.
Thank you.
Operator, we have time for one more question.
Next question comes from the line of Sue Kraft of Manoomin Pioneer. Sue, your line is now open.
Hello, thank you for taking my question. And it's my understanding, but please correct me if I'm wrong, but individual entities, businesses, churches, schools, organizations, my understanding is they can still require mask wearing on their premises to protect their populations, customers, workers, etc. Is that correct?
Yes, Sue, that's absolutely correct. That remains a choice for businesses or other establishments to make. And just a point of clarification, you mentioned schools, and the Safe Learning Plan from the Department of Education with the health guidance support from the Department of Health is still in place until the end of the school year. So some of those masking and distance requirements are still in place for schools through the end of the school year. But your broader question about the ability of businesses to make those decisions, either as a way of, as you said, protecting their workforce and their customers, or just kind of helping to build confidence among their customers that their environment is a safe one. So we are hearing already of some businesses that do intend to keep doing that. But again, it's no longer a state requirement that they do.
Thank you for that clarification.
All right, that is all the time we have for today. We invite any reporters with additional questions to reach out to our office this afternoon. Have a good day, and we'll talk with you again soon.